So call us on 0202 222 for assistance or contact us via our digital channels. We care for your safety, so all our offices are implementing the Ghana Health Services recommended COVID-19 protocols. Please practice social distancing, keep safe, and trust Glyco Life to cushion you for life.
Now, listen, you know me, I care about you. I always want you to have the best. So take this tip and go visit Fabri Metal Ghana Limited. They are the guys who make Fab 500 steel rods. They make them locally using international quality standards, and they won the 2021 Steel Manufacturing Company of the Year. Also, they won Excellence in Corporate Social Responsibility. They pride themselves in being the industry leader in steel, providing the local market with import substitutes at affordable prices. So listen, give them a call on 055-269-8192, or you can try 024-989-6103, or just go visit them. They are in Chopoli on the Tema Aflawo Road. Fabri Metal, your partner in steel.
And the National Cybersecurity Center is now the Cybersecurity Authority. The Cybersecurity Authority is established by the Cybersecurity Act 2020, Act 1038, to regulate cybersecurity activities in the country, comprising registration, licensing, accreditation, and standardization of cybersecurity activities and practices. The CSA is mandated to prevent, manage, and respond to cybersecurity threats and incidents, and to ensure the protection of Ghana's critical information infrastructure. The CSA is mandated to implement cybersecurity measures in the country in collaboration with csa.gov.gh, or call 0302 972 530. Send an email to info@csa.gov.gh.
Okay, so listen, let's get to it. This is a conversation that is of grave concern around the world. The Omicron strain has been identified by the work of scientists in South Africa, but it's yet to be determined where it originated. There are cases in various countries across the world, but as you can well imagine, the response has been, tinctured with politics, as some countries have started to issue bans, travel bans to some African countries. Amongst ourselves already, the African countries are butting heads over where it originated and so forth. But in Ghana, we care about whether or not we have to worry about the Omicron variant. There was a press conference yesterday, and the Director General of the Ghana Health Service had this to say.
We have not identified one in Ghana. All people who are tested positive at the airport are sequenced. The samples are sequenced. It's very important. All of them. We also pick samples from our reference labs across the country to do sequencing. Currently, they have a bunch of about 160 that they are working on now, but there's been no indication of Omicron in Ghana. So all those messages flying around is not true. There's no case in Ghana. But the issue about Omicron is that whatever it is, vaccination is key, social distancing is key, wearing of masks is key. So the preventive measures remain the same. We have not had any evidence that it will pass through a different part of what we know now. So all the mechanisms that are in place continue to work. And we also continue our surveillance to ensure that once we discover, we look at that. Thank you. I think I may call on some of my colleagues to assist. How are we going to enforce? I think I mentioned that we'll be working with the security agencies. They are able to come to the beaches. I'm sure that owners or managers of those places will also be held to some extent accountable. So they also be part of the system to ensure that people who are admitted into a nightclub or whatever are vaccinated. I traveled out of the country recently. The very hotel I'm staying in, I can't get to the restaurant until I show my vaccination card. I mean, I'm sleeping there. And they're able to check. So, yes, the landboarders will continue working through with this thing. But it's closed, and Port Health and security are making sure that people are not, if you know anybody who has crossed, maybe you should report the person. That's on a lighter note. But I think it's a genuine concern, but I know the security services are working and making sure that. And we have also heightened surveillance. Remember, we have health workers all along every district, that border, and we are doing our surveillance. About 21% of the expected population have been given at least their first dose, and 7% are fully vaccinated. But that is, looking at the way we are ramped up, if the people cooperate and everybody comes for their vaccine, we can significantly meet these targets that we set for ourselves. Our land borders remain closed, and I think remaining on the situation now, it may remain closed. I don't have the power to say that, but at least for now it's closed. We will continue to work closely with immigration and other security agencies to ensure that the COVID-19 cases are not imported through our land borders and our sea borders. We have systems in place to check. We are looking at all the three arms of government. All health workers have been given the opportunity to vaccinate, and they stay in a very strategic position that either they can share among themselves or give to their patients. So that's why we prioritize that. All security personnel will be covered. They should be vaccinated. All staff and students in secondary and tertiary schools should be vaccinated. Started last week, Friday. All workers in government institutions and parastatals, all commercial drivers and their mates are expected to be vaccinated at the end of that. Includes nightclubs, beaches, sports stadium, and restaurants for indoor dining. And these are areas that will mean that you need to be vaccinated before you can go into these venues.
Good morning. Wake up to the original magazine show. The Super Morning Show.
So that's what went down yesterday at the press conference. The Director General of the Ghana Health Service addressing some of the issues around this Omicron variant, and of course our vaccination efforts. But look, we need to be a bit analytical now about our situation. We need to be scientific about it, not political, and figure out really what chance we have of gaining the immunity that we need in order to be protected from this and any other variants that might be out there. We're joined by regulars who really help educate us on these matters. First of all, Kwame Sapon-Asiedu. Dr. Kwame Sapon-Asiedu is a pharmacist and a fellow of the Ghana Center for Democratic Development, CDD Ghana. Dr. John Amwesi is a lecturer in the Global Health Department at the School of Public Health, KNUST. He's also a leader of the Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine, KCCR. They, of course, have played a very major role in our fight, our national fight against COVID-19. Doctors, good morning to you both.
Good morning.
Good morning.
Right. So let's dive right in. First of all, Ghana Health Service says no Omicron. We are doing sequencing of every person who comes into the country. If none of those sequencing results have shown Omicron, is that enough scientifically to rule out its presence in Ghana? Dr. Amwesi.
Hello, good morning, Kojo, and to everyone listening this morning. It's interesting how COVID is back on the scene, and I think rightly so. In direct response to your question, the short answer would be no, in that you can never be too sure. Now, I need to just explain a few background issues so that we understand what is going on. This variant was detected in South Africa, but it needs to be very clear that we do not know if it originated in South Africa. The fact that it was detected there does not mean it originated there. Now, if you look at the history of the emergence of new variants, you would realize that they tend to emerge in places where people are looking for them or where they're doing a lot of sequencing. We heard of the very popular South Africa variant, the first version. I don't need to go into the detail, the technical names. And that occurred a couple of months ago and then the UK variant, as it was known. Now, the UK is one of the places where they're doing the most sequencing, and Kwame can tell you more about that. Across Africa, South Africa is a place they're doing the most sequencing. A significant amount of sequencing is being done from the samples collected there. So for me, it's much like the proverbial Akan saying that
Yeah.
So, they're just seeing what they're looking for. Now, if what we're seeing in South Africa is anything to go by, it suggests that there must be many other variants, perhaps of concern, which are circulating across Africa. It's only that we're not looking, and so we are not seeing. If you look at the graphs for the testing rates for South Africa, and you even juxtapose those graphs or curves on curves from other parts of the world, like in Europe and North America, you'd realize that it is very similar. It tends to follow a similar trend. In Ghana, our curves sort of mimic these a little bit, but in other African countries, for example, their curves are very, very funny. They are funny because the testing is very erratic. And so the curves only reflect what your testing stringency or testing activity is, and not necessarily the trend of the disease. Also, looking at what we know just when they decided to do testing at Schiphol, and in Ghana, by the way, we've maintained this testing of everyone who comes in, which is, I think, a great thing that we've been doing. And it doesn't happen in Europe. I was in Europe a couple of times last month, and there's no testing upon arrival. Right. And when they decided to test that flight that came from South Africa, the KLM flight, they got 13 people, not just positive, but had the Omicron. All right. And if they had not tested that day, there'd have been several people slipping through, definitely with Omicron. And we don't know how many have slipped through already. We saw the same thing in Ghana. At the point where we started testing, we started finding some positive individuals. And the fact that you start testing and seeing positive does not guarantee that before you started testing, no one slipped through. Now, fast forward to the situation right now. What it tells me is that, number one, we cannot tell what other variants may have emerged in Ghana. We're doing some sequencing, but it's way under par. There's limited funding and capacity for sequencing. Well, the capacity is not that bad, but the funding is not that great for sequencing right now. Some is being provided by government and other bilateral donors, but it's not at the level that we need. So
forgive me on that point, on that very point, Doc.
Hello,
Doc, if you don't mind, just on that very point of sequencing.
Yeah, go ahead.
So is it accurate that we are sequencing every single sample that we take at the airports?
Let me explain. What I understand is that we're sequencing every positive sample that is, of course, that makes sense, that is detected at the airport.
Right.
This is what I know.
Yeah.
I cannot independently verify, and I don't see any reason why this will not be the truth.
Right.
So
Okay.
I think we can take that as what it is,
Very well.
that we are sequencing every positive sample that comes through. But the question is, there are people coming in through other means. The antigen testing is not foolproof. Even PCR testing is not foolproof, and we know this. And so what I'm trying to say is, what we should say very technical is that no known Omicron in Ghana. It will not surprise me, and not that I wish this by any measure. It will not surprise me. Sooner than later, we detect this. Every day, countries are reporting detection. All those who've looked for it have actually found it. As at November 26, there was a bunch of countries. I'm just trying to go through the list right now that I received. But a bunch of countries had detected Omicron, including South Africa, Botswana, Israel, Belgium, Australia, China, Italy, United Kingdom, Germany, Czech, and the list is increasing in Egypt as well. I think they detected this as well. So when we start looking harder, very possible that we would find. And for me, what it suggests, if you ask me, just fast forward to what should be done, I think it may be time to take a second look at our choice of testing at the airport, either to do PCR confirmatory testing on everyone who tests positive for antigen, or if possible, really, if we can, to jump straight to PCR testing at the airport. It's going to be a bit of a heavy lift, but ultimately, if you look at that, what we call the S deletion, which is actually a signature for this Omicron, you could literally use simple PCR testing to detect Omicron to a large extent, even without going through sequencing. And that really would be great. And this is, I mean, coming from the latest information that I received yesterday on some calls. So for now, we can say, yes, no known Omicron in Ghana. We're testing, we're sequencing every positive test that comes through the airport, but it is not foolproof, and we need to be on the lookout. Later, I can tell you more about what this Omicron means by way of clinical disease and our control actions if the time permits. Thank you.
All right. Yes. In fact, we'll come back to you for that, as well as a bit of education on Omicron and what makes it so dangerous. How far evolved is it from the strains that we know of? But Sir Sapon Siedu, I'm coming to you with this one because I know that it's not always politically correct to spell out gloom and doom. But you always tell us the truth, okay? So let me ask you this. Currently, 7% of Ghana is fully vaccinated. That 7% is part of about 20% of Ghanaians who have had at least one dose. It is still unclear how long the vaccine even remains effective once you have received it. We don't yet have enough doses to actually immunize that 70% that is required in order to have herd immunity. We don't yet have enough doses to do that. And Christmas is coming. We have already started relaxing on the enforcement of our protocols. Christmas is coming, and we're expecting a lot more people to come into the country. With these facts, and bearing in mind that Omicron is only it's just the variant we have detected, and we are already learning that it is likely to be completely resistant to the vaccine that 7% of us have got. Am I being melodramatic when I say there's really nothing we can do at this point? We just have to sit back and hope for the best?
Thanks, Kujo. Interesting question. It's quite loaded, but I'll try and answer it. I'll start from the back, and rightly so. If you say that the vaccines are going to be, and the Omicron strain is going to be resistant to the vaccines entirely, that may not be correct in its entirety because we don't know. What we know is that there are 32 changes to the current virus we have, the strain we have, and some of them allow what we call immune escape. Immune escape means that your immune system may not be able to detect them. And that is what vaccines do, or even wild exposure does. What we don't know is whether the immune escape is from wild exposure or includes vaccines. That said, even if the immune escape includes vaccines, the vaccines would still be effective because the vaccines have a number of components of conferring immunity. The first one is the antibodies, and that depends on the antibody titer, and that's why you'd hear that in the UK and in Europe and other things, they are bringing forward what they call boosters because they want to boost the titers. But then there's the T cell conferred immunity as well, which allows the immune system to identify the virus. That was what John was saying earlier, that there are a number of changes, but amongst the changes, there are some that have stayed the same, which means that if there's strong T cell immune confirmation, the vaccine would make the immune system identify Omicron anyway, and that is why they are saying boost. Now, going to where you started your question from, which is the level of full vaccination and partial vaccination in Ghana, I'll go back to the data and the information we've got out of South Africa, because yesterday I was on a number of, calls and other things like John was saying. And what we are getting is a lot of the mutation took place in people who are either immune compromised and have had the vaccines, but didn't produce enough antibodies or didn't get enough T cell training, or people who had been partially vaccinated, hadn't gone for their second dose. And as a result, what have these two people done? They have allowed this virus, and viruses are like human beings. If you live in the winter, you look for a coat to wear. If the coat is not good enough and it goes below 0, you look for a bigger coat. If you then come into, the tropics, you take your coat on and you wear a t-shirt. That's what the virus is doing. So the more you leave the virus in an environment where it stays in the antibodies that are supposed to neutralize it, it starts finding ways of evading the antibodies. So the answer is, the more vaccinations you get, the less likely these variants would occur. Right. So in a country like Ghana, where vaccination is low, and that's why I agree with John, it's more than likely we could have other variants, not just the Omicron, but other variants emerging based on the information coming out of South Africa. So the idea now is, if you're giving a vaccine, please take it. If you've had one dose, have the second dose. If you offer the booster, take it, because we need to constrain this virus. It is a virus that is teaching us a lot of lessons. And I get so many questions around this. And people tell me, oh, is this the only virus that's doing this? And I tell them, no. We had, the plague in the 14th century. We still have cases of the plague today, just that people do not know. We have cases of the plague today because the microorganism has, to this point, even though we have drugs to treat it, managed to evade and occasionally rears its head. The same, we have H1N1. If you look at the the Spanish flu, it lasted for 4 years because the virus changes. And that is why today, even that virus is with us over 100 years and over. And that is why every year we tweak the vaccines to be able to confer immunity to at-risk populations. So for me, if the question you're asking, my answer is not a lot has changed. To be fair, not a lot has changed in the strategy. We have another virus that may be more transmissible based on the information I've seen, may have better immune escape, may give a higher viral load. We don't know about the impact on disease, hospitalization, and mortality, because it takes time for these things to happen. Right. But we also know that we have gotten here because there's low vaccination cover in some parts of the world compared to the others. And so you would realize that today, I've just picked information that Scotland has just reported, just about 5 minutes before I came, it was on the dashboard wires that in Scotland, they've now picked Omicron that has no link to travel to Southern Africa or any other country, or internal travel to the UK from someone who's tested positive. The first indication that community spread has already started in the United Kingdom. What does that, and what are they saying? It is happening in the non-vaccinated population. That is where they think this. And so I share these information for us to realize that the strategy to keep us safe hasn't changed. This using of face masks, hand hygiene, social distancing hasn't changed either. So going into Christmas, if we maintain, then we are in for trouble. If we augment our compliance with the protocols, if those who have to be vaccinated take the vaccines, we will put ourselves in better stead. But more important, if our pandemic managers test more, sequence more, we would know exactly where we are. For now, I don't think there's any reason for panic. So I'd leave it at this point for now.
So for you, we must augment our protocol enforcement and then sequence more, test more and sequence more. Okay.
Yes, I mean, that's the only way, because like I said, like John was saying earlier, every minute the countries that are reporting, and I add this, the interesting thing was when the reports of Omicron started, they started on the 11th of August. That was the first identification. Then that was in Botswana. Then there was the 14th of August, of November in Southern Africa. The first announcement came on the 24th for obvious reasons, because they had to sequence, they had to do a number of things. Yeah. On the 25th, there was a report in Israel. On that same day, there was a report in Hong Kong. Immediately, I made a Facebook post to say, based on global travel, considering that you cannot get to these countries without transiting through Europe from Africa, the thing was all over the place. Yeah. And it was just based on the travel track. There was no way it could get to Hong Kong or Israel without coming into Europe. Yeah. And so if that is the case, and there's more travel, intra-African travel, I wouldn't be surprised if it's all over the place in Africa as well. And that is why you realize that the South Africans are making a lot of noise about the relevance of these travel bans, because if you look at it starting from the 11th, probably it's all over the place already.
All right. Dr. Amwesi, first of all, I mean, I think Kwame has given us a bit of an insight into the Omicron virus and, the significance of it, how different it is from what we already know. So that leads me to my next question. How scientific are these travel bans that are flying around the place? Will they do anything at all to slow down the spread of this new variant?
Thanks, Kojo. I think Kwame has really thrown a lot of light on how this works. And I think the average scientifically inclined person can conclude that these travel bans instituted by the UK and Europe and very soon America are totally out of place and unscientific. They are nothing short of discriminatory. And I totally agree with South African President Cyril Ramaphosa that this is really discriminatory in its own self. As I said, the South African scientists, and they have a network of over 7 premium institutions in that country that are doing sequencing round the clock, actually doing perhaps more sequencing than many other European countries, to be fair. And for this to be done to them, given when we know Omicron actually emerged, is totally unfair. What should be done is similar to what Ghana is doing, which is to, if you would, test all travelers. They stopped testing upon arrival ages ago. We are continue to do that in Ghana. And as I said, my only recommendation is that if we could, and again, I say this with caution, knowing that it would be a heavy lift, if we could, to move to PCR testing. But they have the luxury of this, and they're already now testing people who are coming from South Africa. This is prior to the institution, just prior to the institution of the ban. So for me, what I would do is just to institute the testing at the airports, and they're not willing to do this because of just the effort they'll put into it. Is the cheaper, I would say cheaper, but the easier way to do this and to be sensational about it and try to look good in the eyes of your citizens, especially because in many countries, including the UK, some actions were taken rather late, especially with Delta, that they want to just attack this with a sledgehammer and be seen to be, doing something really heroic, when they know very well that is not the solution. As Kwame put it, the real solution to this and to the risk of other more virulent variants arising is really vaccination. And this is not rocket science. It is just simple science. The more people are vaccinated, the less the risk of variants emerging and taking a hold and spreading. And to think that the focus now is on booster jabs in many parts of the so-called more developed world, whereas in other parts of the world, people don't even have the first dose, and then to slap a ban on no country but South Africa for just doing a good job in sequencing and putting this out is just totally unfair. I'm expecting noise to come from the AU, just like we did when the UK initially decided not to accept travelers who had the COVAX vaccine, which they themselves have helped finance, and they rescinded that decision pretty quickly. I'm expecting the AU also to be up in arms and make noise about this very unfair treatment that is being meted out to South Africa. And look, we are most likely to be next in line. What happens is that when a country detects Omicron, they're not going to talk about it because they know that they'll be next in line for a travel ban, and that doesn't help anyone. So I think this is rather unfortunate, and it must be, should I say, condemned, for lack of a better word, directly.
Right. We're talking with Dr. John Amwesi and Dr. Kwame Sarpong-Asiedu about the Omicron variant of the coronavirus. Should you be worried? Are you safe? When we come back...
Yesterday at the press briefing, the Director General of the Ghana Health Service did disclose that cases recorded in November 2021 is higher than what we recorded back in 2020. I wonder what this means. And then also a quick reaction to what we've decided to do, declaring December as the month for vaccination. So if you're going to the nightclubs, beaches, restaurants, stadiums, you have to be mandatorily be vaccinated. I want to get some reactions from our guests when we return.
That and more.
Why do you allow coughs, cold, and flu to ruin your happiness? You need Summerlin cough syrup. Summerlin cough syrup will relieve you and your family from coughs, cold, and flu. Summerlin offers a whole range that provide relief for the entire family. Insist on your Summerlin in pharmacies and licensed chemical shops. Summerlin cough syrup from Danex Itin Starwin PLC. If symptoms persist after 48 hours, consult a physician. This advertisement has been vetted and approved by the FDA.
The legends have gathered. Brace yourself for massive thrills as MTN celebrates 25 years of brightening lives with the very best of GH music at the MTN Music Festival 2021. Yes, the first Christmas party of the year goes live at the Grand Arena with some of Ghana's finest. Kwabena, Sugar Daddy Kiddy, Obaba Christie, and the rock star Kwame Eugene on Friday, 3rd December from 7 p.m. sharp. Tickets are selling now at 50 Ghana City Standard and 100 Cities VIP from Joy FM. Nalam Clothing at the Accra Mall and Ahum Store, Palm Wine Junction, La Accra. Dial star 713 star 217 hash and follow the prompts to purchase with Momo and enjoy a cool 10% discount. Don't be left out. Join us as we set the tone for a very merry December at the MTN Music Festival 2021. All COVID-19 protocols will be strictly adhered to. This event is powered by MTN. Everywhere you go.
What would you do if you have the choice to do anything in life? Build your dream house, take very good care of your family, and plan for a comfortable retirement. Plan a befitting funeral for your loved ones when they depart. How would you live if you knew there was a friend waiting to support you on all of your life's choices?
You have such a friend in Glyco Life Insurance. Glyco Life has all the plans to meet your life's needs. Your child's education, your life savings, your mortgage, funerals, redundancy, and your retirement, and takes the burden off your shoulders. So go ahead and live life to the fullest today with Glyco Life Insurance plans. And remember that all our policies are hedged against inflation. Talk to Glyco Life on 0302 218 500 or 246 142. Also visit our website at www.glycolife.com or any of our branches nationwide for more information.
Glycolife, we cushion you for life.
Glyco, we cushion you for life.
Putting up or replacing a roof is not just laying the panels, it's a complete engineered system. And at Roofings and Steel Ghana Limited, we understand how the whole system works and are resolved to give you the very best quality in roofing and steel products. Manufactured locally in Ghana, we offer a range of steel and galvanized pipes, mild steel plates, and all ranges of roofing sheets, IBR and IDT, corrugated and galvanized. Our locally manufactured products are tropicalized to withstand local conditions. Distributors, wholesalers, contractors, builders, welders, and fabricators. It's time to get the best quality roofing and steel products made in Ghana. Visit our office at Chopoli on the Tema Aflawo Road. Call us on 0559 722 035 or 0552 571 173 or 0242 539 411. Roofings and Steel Ghana Limited, your strength in steel.
It's Hollandia yogurt, a nourishing snack.
Check.
Vitality.
Check.
Taste.
Check.
Vitamins, calcium.
Check.
It's Hollandia yogurt. It's Hollandia yogurt. Hollandia yogurt.
Enjoy a nourishing boost of vitality with Hollandia yogurt. Available in strawberry and plain sweetened, fortified with vitamins A, B2, B12, and a source of calcium. Grab a pack of nourishment and level up. This advert is FDA approved.
The fitter you are, the fresher you feel. Stay hydrated with the refreshing goodness of Voltic Natural Mineral Water, sourced from the heart of Ghana for true and safe refreshment.
Voltic, naturally, a product of the Coca-Cola Company. This advert is FDA approved.
Good morning. Wake up to the original magazine show. The Super Morning Show.
Coronavirus, COVID-19.
Welcome back. It's the Super Morning Show on Joy 99.7 FM. 9:39 is the time. And our guests, Dr. John Amwesi and Dr. Kwame Sapon-Asidu, are helping us get our heads around this Omicron variant and whether or not we need to worry. So far, it seems that our plan, if we stick to it and actually implement it, should be enough. But there's more to learn. We'll get into that in a short while. First, Kingdom Books and Stationery Limited have done it again. Now they're giving you the chance to buy from them without actually going to them. You can just go to kingdomstoreonline.com and buy from there. And of course, you can pay via Momo. They will deliver to your home or office. And if you're in Accra or Tema, it'll be free delivery. Terms and conditions do apply. At Kingdom, quality and affordability is their hallmark.
The sights and sounds of Joburg, a day of shopping at Nelson Mandela Square, bar hopping in Soweto, Big Five watch at Kruger National Park, immersive cultural experience at the Robben Island, and Winsing is thinking about it. So much more to do in Joburg. This could be you and your mates this festive season in Joburg. But you haven't visited www.southafrica.net to book the best package deal for your getaway. So what are you waiting for?
Well, you need a funeral plan that is more than just a funeral plan. Introducing the Allianz Farewell Plus, a life insurance policy that enables you to cater for the funeral expenses of your loved ones and also take care of the policy holder. Speak to us about the many benefits that come up with Allianz Farewell Plus, including cashback, premium waivers, grocery and airtime vouchers, and a lot more. Terms and conditions apply. For more information, call us on 0302 267 or visit our website, allianz-gh.com. Follow Allianz Live on Facebook, LinkedIn, and YouTube, on Allianz Ghana, and on Instagram, Allianz_GH. Allianz Live, we secure your future.
Yes, indeed. All right, so let's get back to it, shall we?
Yes, Dr. Kwame Sapon-Asidu and Dr. John Amwesi, we're grateful that you're still with us. So I wanted to know what it means when we're told that November 2021 we recorded higher numbers of positive COVID cases than we did in 2020. That's the first leg of my question. And the second one is, what do you make of the plans that we've put in place, declaring the month of December as the month for vaccination, and the fact that you must definitely be vaccinated before you go to certain places? I probably will start with you, Dr. Kwame Sapon-Asidu.
Okay, interesting. When you said that, what I went to do was to quickly look at the testing done in November of last year compared to the testing done in November of this year. And like John said earlier, the more you test, the more you find. We tested more this year than we did last year, which is a good thing. Because last year, because the testing levels were low, and I'm quite sure Kojo and Winston would remember that some of us kept harping on that our testing levels had dropped and we need to pick it up. It was coming up to the elections and all that with low testing. And then we got a sucker punch in December because we didn't know what our infection rate trajectory was. If people remember as well, at that time, there was a prevalence rate study which was released, which showed that our prevalence of people with antibodies was much, much higher than our case reporting. So when that learning is there from last year, and I realized that this year we are testing more, and I realized that we are finding more, it doesn't worry me. Because again, like any other disease, the earlier you identify the patients, the better the prognosis. That means the better the outcomes of them getting very badly sick, them getting hospitalized, them getting severely sick, and unfortunately passing away. So for me, that's a good thing. And then it pins on to the fact that they are saying that December is the month of vaccination. If you are finding more this time round compared to last year, then you know that there is enough susceptible population for community spread. And John said before we went on the break, if you don't vaccinate and comply with the protocols, you would have still more community spread. So if you are finding more, then the reason is what I was talking about earlier, augmenting your fight strategy. Increase protocols and vaccinate more, and also prevent community community spread. If you are not vaccinated, you cannot go into closed spaces where, activities that increase the likelihood of human interaction and therefore increase the likelihood of infection. Because one thing we have to bear in mind, based on the data that's coming out of South Africa, is that they are saying that the transmissibility of this new strain is much higher. Already we are dealing with Delta, which has a reproductive number between 5 and 8, and we know what it did to us. If the transmissibility is higher, it means the reproductive number for Omicron has increased. We don't know the number now, but from the simple information we are getting from the Johannesburg and Gauteng area, where this has quickly taken over, albeit we're getting information that the disease lethality or the disease potential is much lower, but we still don't know. It tells me that you don't want to get people who are neither vaccinated nor complying with protocols into an area where transmission is high. So looking at the strategy, if Ghana Health Service go with this and the testing increases and they ramp it up and the sequencing increases, we probably would be in the best place we could be compared to January this year, where our mortalities in the first 6 weeks was the highest we've seen since COVID came to Ghana. In the first 6 weeks of January 2020, we lost 330 people, which was the highest we had ever seen. We don't need to get to that place, and that is why I'm very comfortable with this strategy.
Right. I'm thinking about what this means for the future. Today we have the Omicron variant, which has 36 different points of evolution, right? Compared to the pre-existing variant. This virus can continue to mutate. It can continue to evolve, and we can have even more dangerous variants in the future. The only real solution appears to be if enough of us get vaccinated quickly so that the virus doesn't have so much space to evolve, as you explained earlier. If that's the only solution, then should the whole world now adopt a new strategy? Should we now, instead of some countries hoarding the vaccine, jumping ahead of the queue to get it before others, should we now simply open source the thing and allow everyone to produce enough vaccine so that we can all be protected?
Kojo, I'll go quickly so that John can have, because this is an area for John. The truth of the matter is currently there's enough vaccine. I've been the one who has talked about vaccine constraint for a long time. If you look at the supply chain data, there's enough vaccine. And there's Novavax coming upstream. They've already put in emergency use authorization to the WHO, to the UK government, to the European Medicines Agency, and to the FDA in the United States. So there is enough vaccine. The problem has been, and you see, this is where sometimes I fault African countries as well. About 4 weeks ago, AstraZeneca unilaterally declared this pandemic as over and started saying they were going to start profiting from their vaccine, even though they had promised that they were not going to profit from their vaccines until this pandemic was over. And I did write an article then and said, on what basis were they making the declaration? Because the WHO in that same week had warned European countries about the booster gap and the fact that if they deprive countries in Africa and lower middle income and lower income countries from vaccines, then we were going to have variants and it was going to set the clock back. That is where we are now. But unfortunately, when AstraZeneca said that, no one jumped. I jumped because I saw the issue with what they had said. Nobody is clothed with the power to declare this pandemic as over apart from the WHO through its Secretary General and through its Pandemic Management Committee. Yeah. But Africa would sit down and then these things happen. Already they started taking commercial, and I repeat, commercial contracts for vaccine supply to some of these countries on a tiered basis, meaning that they look at their affordability based on your fiscal space and they say, I'm going to charge you this, I'm going to charge you that. Wow. All other vaccines are charging anyway. So if the African countries do not shout and we allow these things to go on, and the few of us shout, and sometimes when we are shouting, people would continue to say, oh, but the pandemic, no one is talking about it. Then we get to this point, and I start reminding them, when I was shouting 5-6 weeks ago about this thing and it was going to hit us in the face, none of you saw it. Now it's punched us in the face, and we are saying we should liberalize vaccine manufacture. We cannot go round and round in circles to do. And that is the answer to your question.
I'd love to hear Dr. Amwisi on this as well. I mean, in terms of the science, we've got just 1 minute to go, Dr. Amwisi. In terms of the science, looking into the future, if Dr. Sapon-Sedu is right and there are enough vaccines, what should be step one right now? What should the world be doing differently to avoid, some Omega variant coming along and killing us all?
Right. So I think Kwame has really nailed it. The key is vaccinating as many as possible, as quickly as possible. I think this is a clear testament to the fact that the world is not safe until everyone is safe or is vaccinated, for that matter. Especially in parts of the world where vaccination rates are low, the risk of new variants emerging becomes higher and higher. We now see this very clearly. What the good news is that there are many more vaccines being developed, and clinical trials are ongoing, including right here in Ghana, for newer, including protein recombinant vaccines and others. Intranasal spray vaccines hopefully will come around as clinical trials progress. What this means is that there'll be many more options on the table, hopefully cheaper and more available. But in between, we cannot tell what will happen. And there really is enough vaccine to go around for everybody if people will do the right thing. It's a shame. And I think we need to call this out more loudly, that the Western countries will hoard the vaccine, will call for booster jobs for their populations. And then when an African country does a great job by detecting a new variant and putting it out there, they slap a travel ban. I think this is the continued neo-colonialistic activity, which we decry and should be condemned seriously. I'm expecting a lot more noise to come from the quarters of the AU, because very soon, if you're not careful, Ghana and other countries will be put on that list at the moment we detect something. So yes, the pathway is definitely vaccination, especially because adhering to the other preventive protocols is so difficult in our part of the world, and also to facilitate the conduct of more clinical trials for the new vaccines that are being developed. I really hope that nothing really terrible happens in between now and then.
Well, let's hope that hope is not our only strategy. Thank you so much, Dr. John Amwisi of KCCR and KNUST, and of course, Dr. Kwame Sapon-Sedu of CDD. Thank you both for your time. God bless you. It's the Super Morning Show, and we've got just about enough time to take some messages and wrap up beautifully. Stay with us.
I did the vaccine, and somebody said, "Papa, where's your faith?" And I said, it takes faith to take the vaccine. It takes faith. And I said, the reason why you are not taking the vaccine is because you are afraid. You are afraid of what will happen to you if you take the vaccine. You are afraid because you become a victim of conspiracy theories on social media about the vaccine. Meanwhile, we take other vaccines, polio and yellow fever, all different kinds of vaccines. We've been taking it for years. What is the difference between that and this? Oh, this one is too quick. This one was done too early. Church, vaccine is vaccine. And if you think I don't have faith for taking it, you are joking. I have faith. But taking the vaccine is also common sense. And it's also wisdom. So if you haven't taken the vaccine and you have opportunity, take it. And for those of you who have the faith not to take it, don't take it. Don't take it. I'm not forcing I'm not telling anybody take it. Yeah. If you have the faith not to take it, don't take it. But don't go around telling anybody that don't take it. I haven't taken it, so you too don't take it. Your level of faith is different from the level of faith of others. Do you know the level of my faith? I have tested 22 times negative. 22 times. I have all the results. Negative. 22 times. Yet, I am not taking chances with the life of other people. Anything will happen to anybody that took it, not me. No, minus me. I am exempted from any conspiracy theory of the vaccine. I'm exempted. If you don't have what to preach, stop preaching.
Morning Show.
BNG, Tatum, with G Money on every mobile network. Hello everyone, it's your rockstar Kwame Eugene. When I'm performing on stage, I prefer to work with a band that knows and understands my music. Together, we create a synergy that blows the roof. Likewise, in my day-to-day transactions, I rely on G-Money because it aids me with smooth and secure transactions to all networks and banks. The G-Money mobile wallet is powered by GCB Bank. It is the safest and most secure wallet. With G-Money, I'm always the G that gets things done. I am able to quickly receive and send money to my loved ones when needed.
Be a G like Kwame Eugene. Walk to any G-Money agent or GCB Bank branch near you and sign on today with the Ghana card. Dial *422# and make transfers to friends and family on all networks without hassle and experience a variety of packages on G-Money. To be a G-Money agent, walk into any GCB Bank branch and get registered. It pays to be a G, so be a G. Tratum with G-Money.
Maudada no pediani bianye di pa and the pe wo malt milk ena koko mu a ema milo mu da shima.
From Nestle.
Every ahwehwe side dwade nkrato yi mu agya dum se eye.
Wow, wow, wow. Hope you have heard, rent to own now in Ghana. The Flan City Extension Project, rent to own land and house ownership scheme by the Ningo Prampram District Assembly and its partners, supported by the Ministry of Local Government and Rural Development and the UN Habitat, are right here in Ghana. So be smart, because where you trade and live really matters. Apply now and own a home or a fully serviced land. Wait a minute, don't forget to join our affiliate housing cooperatives also. Special offers last up to October 31st, 2021. Call us on 055 55 3300 or 0577 911101 and 055 7054 635. Website newaccra.city. Plant City Extension Project, shaping Ghana's urban future.
Charlie, this festive season, I feel good because I choose riveting non-stop sports action.
And Maguire tucks it away. It's 2-2.
And I choose local drama where you get plot twist.
You are not only late for your mother's memorial, but you also brought someone along who's not a member of this summit.
And I choose hip twisting world-class music. And they choose romantic shows where they be.
How can you and every other man forget the love of your life just like that? So easy, so quickly.
For kiddies, and they choose cartoon shows where laughter and quality.
We've got a serious case of the wedgies.
Charlie, make you choose over 80 channels full of joyful entertainment. Make you to choose joy these holidays. Make you choose DSTV for 169 Ghana cedis per AB Standard, the HD decoder, diskette, and 1 month DSTV access package all day long. DSTV, it's your moment.
I do my voice on this beats.
You're on the Super Morning Show now. The Plan City Extension Project rent to own now in Ghana is getting better and bigger. The rent to own land and house ownership scheme by Ningo Prampram District Assembly and its partners, supported by the Ministry of Local Government and Rural Development and the UN Habitat. Be smart. Where you live and or trade matters. You can own a home and or a fully serviced commercial land or space now by contacting 0555 530 300 or 0577 911 011 0557 054 635 or 0577 911 101 or just visit newaccra.city. The Plan City Extension Project shaping Ghana's urban future.
All right, so listen, you've heard the experts. If you're going to do anything today, just make sure it is washing your hands frequently and carefully with soap and water. Now, rewash them several times a day, especially after touching anything, including your phone or laptop. Remember to use hand sanitizer when you can't wash your hands properly. Wash fresh groceries. Clean and disinfect surfaces like countertops, door handles, furniture, toys, laptops, and mobile phones with alcohol-based disinfectants. Okay? Please do this and stay safe. Right, friends, it's been a good one.
Yes, Coach, but before we go, it's John Mahama's birthday today.
Oh, yes.
President John Dramani Mahama. So a happy 63rd birthday.
Wow.
Yeah. Happy birthday, sir. Enjoy the day.
Yeah. Also, some sad news. Virgil Abloh passed away over the weekend. He, of course, is the Ghanaian designer who works with Off-White and Louis Vuitton. He was battling cancer. He lost his life. May God rest his soul. Thank you all for listening. We're back with more tomorrow.
Stay for the news. Hannah is standing by for the headline news at 10.
Just how much we love you.